Hello everyone, welcome to BioTales. Scabies is a mite infestation that results from the direct skin-to-skin contact with someone who has scabies and produce an itchy rash on our skin. This is caused by a mite called Sarcoptes scabiei. These little bugs make tunnels under your skin to live, feed, and lay eggs. Our skin reacts to the mite by developing an itchy rash. Scabies spread easily from person to person, especially among people who live close together as a family. If one family member has scabies, a healthcare provider should check and treat other family members and close contacts at the same time. Now we see what are the symptoms of scabies. Scabies causes a very itchy rash on your skin. If it's your first time getting scabies, it might take up to 6 weeks for the rash to appear. If you have had scabies before, the rash can show up in just a few days. The rash spreads slowly and may last for weeks or months. There are some other symptoms that include intense itching, especially at night, which can make it hard to sleep. Painful bumps or sores that might get infected from scratching. Small raised lines or bumps on the skin, which are the tracks where the mites have burrowed. Children with scabies might itch all over the body and could become cranky or tired due to lack of sleep. Now we see what are the different types of scabies. There are 3 main types of scabies that include typical scabies, nodular scabies, and Norwegian or crusted scabies. Now we see what is typical scabies. The most common type is a typical scabies that cause an itchy rash on hand, wrist, and other common areas. What is nodular scabies? Nodular scabies causes itchy raised bumps, especially around the genitals, armpits, or groin. Now we see what is Norwegian or crusted scabies. A severe, highly contagious form of scabies is Norwegian scabies, leading to thick skin crust filled with thousands of mites and eggs. This type is life-threatening and usually affects the people with weakened immune systems, such as those with HIV, certain cancers, or those undergoing chemotherapy. Now we see that where these scabies mites live. Mites often live in the folds and creases of the skin that include between fingers and toes, around the thighs and genitals, on the wrist and knees, around the waist, under fingernail, under rings, watches, and bracelet. Now the question is that, can you see the mite? Scabies mites are tiny, about the size of a needle tip, making them very hard to see. They are white to creamy white in color and have 8 legs with a round body, which you can see only under a microscope. Now we see that what is the appearance of scabies rash. The rash can look different depending on your skin tone. It may appear red, brown, gray, and might resemble hives, insect bites, or pimples. It can also show up as a line across the skin. So how these scabies can be diagnosed? A healthcare provider can diagnose scabies by examining your skin and taking a sample to look at under a microscope. The sample is usually taken by scraping the skin or using a needle to remove a mite from its burrow, then checking for mites, eggs, or feces. So what are the treatment of scabies? Scabies is treated by killing the mites and eggs with medicated creams or pills, which are available only with prescription. Your healthcare provider will likely to ask you to apply the cream all over your body from the neck down and leave it on for 8 to 14 hours. Sometimes the treatment needs to be repeated if new symptoms appear. There are some common treatments that include permethrin cream, a cream that kills scabies, mites, and eggs. It's safe for adults, pregnant or breastfeeding women, and children over 2 months old. Sulfur cream. It is applied overnight for 5 nights in a row. Safe for use during pregnancy and for children under 2 months old. Ivermectin or stromatol, a pill that is used when cream doesn't work, often prescribed for severe scabies or people with weakened immune system. It is not recommended for pregnant or nursing women or children under 33 pounds. Now we see that how the spread of scabies can be prevented. To prevent scabies from spreading, you should wash clothes, towels, and beddings in hot water at least 60 degrees Celsius. Seal non-washable item in a bag for 8 days. Put mattress, pillows, and blankets in the sun. Vacuum your home and soft furnishing. Avoid skin contact with items that can't be washed or placed in the sun for 3 days. So, how you can prevent scabies? There is no vaccine for scabies. The best way to avoid getting it is to stay away from people or places with known scabies outbreaks. It spreads easily among people living in the same house or sharing a room. Its outlook or prognosis: while scabies can be uncomfortable and last for weeks, your healthcare provider can prescribe medication to get rid of the mites and relieve symptoms. It may take up to 2 months for your skin to heal. If symptoms don't improve or if you still have a rash after 4 weeks, talk to your healthcare provider as you might need another round of treatment. Make sure to wash your bedding, clothes and towels and clean your floors to eliminate any leftover mites.